Welcome. Today we're going to be covering Frankel. Frankel, who developed the Frankel appliance system that were a revelation, was a completely revolutionary approach.
Yeah.
And for a period of time it had a big impact.
Yeah.
So we're going to cover the Frankel. First of all, I want to talk about the man himself.
Yes.
Nice guy.
Yes. I first met him in Zwickau when I went there in 1969.
Yes. So how had you heard it? Because you had become interested in Frankel. Sorry, you'd become interested in functional appliances.
Yes.
Because of Willy Grossman.
Yes.
So Willy Grossman had left Germany because he was Jewish, and
yes.
he left before the Second World War, very sensibly. And he was then in charge of orthodontics in UCH.
That's right, where I learned.
So you'd become interested, we'll cover that in detail at some point. But you'd become interested in functional appliances.
Yeah.
Then when did you hear about Frankel? When did you hear about his appliance system?
He was just reported in the literature, that's all.
Okay. Had you seen any results from Frankel?
No, not at that point, but I liked what he was saying.
Okay. So then you happened in early 69, you happened to be skiing with my mother,
Yes.
Jo, your wife.
Yes.
Did you not take Bill on this trip with you?
Take what?
You didn't take William, my elder brother, on the trip?
No, he was with his grandmother.
Right, okay. So, your wife, my mother, was pregnant with me at the time.
Yes.
Okay, so I'm in utero.
Yep.
So you decided to you explain the story.
Well, I thought we were skiing in Zurz, which is in Switzerland, not far from Munich, and Zwickau is a short distance from Munich too. So I thought I would like to go and visit this chap because he seemed to be thinking in the same way as I was.
Okay, so you wrote to him.
Yes.
And?
Well, at that time, he was behind the Iron Curtain, and no visits by English people were allowed at all. But I wrote to him, and he invited me. Because he gave me an invitation, then the communists, who were in power, decided to let me come.
Okay, because they were very pro-education.
Yes, I had no passport or anything to help me, no visa, no nothing, just a letter.
Okay, so then you went on the skiing trip. After the skiing trip, you headed down to the Iron Curtain. And what happens here?
Well, at the border, they didn't like my letter, so they threw me off the train, which was fairly tough. It was midwinter and dark by that time in the evening. They shut me and Jo, your mother, up in a small wooden hut, which wasn't heated. It had 2 chairs in it, nowhere to sleep, and we were left there all night. When I looked out of the window, I could see machine gun towers all the way round. We were right close to the border, and they were very anxious that no one escaped. So I can remember going to sleep on the wooden floor of this hut that night, and then waking up early in the morning when the guards came to collect us and saying, yes, we could go on the train.
Okay, so that was exciting.
Well, not very much fun.
And my poor mother, heavily pregnant, not heavily pregnant, because I was born in July.
Yeah.
So she's not so heavily pregnant.
Well, she'd been skiing.
Yeah, she'd been skiing. So you then went to Frankel's clinic.
Yep.
And what were your observations?
It was just an ordinary dental clinic. And I was very interested to see his appliance, but probably even more interested to see how the children took to it and what the responses were.
Okay, so and what did you feel?
Well, in all, I realized it was an entirely different approach to orthodontic treatment. He was purely attempting to change posture. Mainly,
no, function.
well, all right, yes, the function of the cheeks,
Yeah,
you're
but,
right.
but muscle and body, he's not looking to move the teeth. He's
No.
literally just trying to change the oral environment.
Yes, he was trying to change basically the way people swallowed.
And the use of their perioral musculature. So,
Yes.
so the muscles around here.
Yes.
Okay, so go on.
And he created this appliance, which was called the Frankel, and basically it purely fitted in the vestibule. In fact, it was really just...
Okay, so what we're talking about the vestibule, it's this sort of area around
Yes,
here. Yeah?
between the cheeks
yeah.
and the teeth.
Yeah, between the lips or the cheeks
Yes,
and the teeth. And
Yes.
the teeth sitting in their bone, clearly.
yes.
Okay, so then, so tell me more. So this,
Well, they just mainly fitted there with the only real effect it had on the children meant that they couldn't suck on their teeth or palate when they swallowed. They had to put their tongue on the palate
well,
in order to be able to swallow.
so they had to put their tongue on the palate in
Yes.
order to be able to swallow. There was
Yes.
no other way of doing it.
I don't think so. I never explored that far, but that seemed to be the effect.
Yeah, that's a really sensible approach. So while you're wearing the appliance, and I've got a good way of describing this.
Yes,
I say that what you've got, so whenever so we're not supposed to use any of the muscles
Absolutely.
of facial expression when we're swallowing.
well, it hurts if you use them.
Well, no, wait a minute, one step at a time.
Yes.
We're not supposed to use the
Right.
muscles. Now, when you do use those muscles, it's a little bit like when you contract your bicep.
Yes.
Okay, the bicep becomes thicker, but it becomes shorter. It doesn't change its volume, it changes its shape. Now, if I use the perioral musculature around my it's as if I've got my finger up here. As I swallow using the perioral musculature, it pushes my finger down because, of course, the sulcus is becoming shorter. Okay? And that's the action of the fibers of the muscles running round, attaching into the bone. Okay? So what the plants would do would have two actions. You've got the tongue in the middle, you've got the cheek and lips on the outside, and you've got the bone, the alveolus, so the alveolus bone, you've got the teeth, and you've got the gums. You've got this sort of, the teeth and its housing sitting between the tongue on the inside, the lips and the cheek on the outside. Now, we've all got malocclusion. Nearly all malocclusion is the tongue isn't pushing out effectively. Okay? So, what you do is you hold back the lip and cheek, so you favour the tongue. And that's where he was getting his expansion.
Well, essentially, yes.
But on top of that, because you go so high in this sulcus, as you contract these muscles all around here, they impinge or they interfere with these extensions, these buccal shields or these buttons down here, and that reminds you not to do it.
Yes.
So you have a negative, it's uncomfortable.
Yeah. You can't even smile.
Yes, I remember you reminded me of the story about
Well,
the
that
smiling.
was what I discovered in his clinic. I would walk into the clinic in the morning, and there was the long corridor. The patients would be each side. I would smile to them, but they would never smile back. Because it hurt.
Because you had a function. So you can't use any of the musculature. Basically, it's inhibiting the use of the musculature. We're doing two things. First of all, it's physically holding the lips and the cheeks away, but then also it's inhibiting their use to train you to change. And as you say, one of the direct results of that is while you're wearing a Frankle appliance, the only sensible way to swallow is by putting your tongue on the palate. Was he training people to swallow correctly as well?
He talked about it. I don't know that I saw him do that much. He wasn't giving oral myology.
But maybe he just wasn't doing that the day you were there.
Well, maybe he just told the patient to swallow with their tongue correctly. I'm sure he was aware of that, but he didn't go to any lengths. He relied on the appliance.
And but you maybe he had a therapist there on the day you weren't there who was training
Could
people.
be, but the appliance did it for him.
Yes, that's an excellent outcome of this appliance. Now, how much were the children? How often? How long? How many hours a day were the children wearing these appliances for?
Oh, they were full time.
Full time. I thought that he was only asking for about 18 hours a day.
I don't remember that.
Okay, because it's various different reports.
They used to moan about wearing it during the day, and I think he asked them to wear it at night as well.
Yes, I would imagine that. Yeah, it's easier to get people to wear things at night.
No.
So, now you went out in '69, early '69, to see him. I presume other people had been out ahead of you. You weren't the first
I was the
Westerner.
first Englishman.
But what about people from other countries who've been visiting you?
I think quite a few Germans. I don't remember anyone else much.
Okay, so no Americans, no...
Oh, no, no Americans.
Okay, so you, in a way, were one of the first ever to go out and meet him.
Yes.
Yeah, okay. So, you maintained a relationship vaguely with his daughter afterwards?
Well, we good friends. He came and stayed at our home.
Yes, I kind of vaguely remember Frankel coming to stay, but he wasn't very engaging.
Well, no, he was an old man by then.
Yes, yeah, yes. And also, his English wasn't very good.
No.
No. So I can't claim I was ever babysit by Frankel. Okay, so now we want to really emphasise that this was a completely different appliance. Yes?
Entirely different approach.
Entirely different approach than what anyone had ever done before.
I think so.
And it was there's been this discussion. I've just looked up two meta-analyses. There's a meta-analysis by Yang in 2014 and a meta-analysis by Perello in 2011. Both of whom seem to... So this is a meta-analysis where they've gone back through all the data they could find. And both of them come to the same conclusion: we need more high-quality research. Not enough is known about it. Both seem to suggest that there is evidence that the mandible can come forwards, but less evidence that there was an effect on the maxilla. And I also found so I'll link both of those articles down below as the two meta-analysis. Then I also found a discussion between Jim McNamara and Gottlieb.
Who?
Another orthodontist.
Right.
I'll just get his name wrong and embarrass myself and insult him. In the Journal of Clinical Orthodontics.
Yes.
I think that was in 93. No, sorry, 83. So that was in 83 in the Journal of Clinical Orthodontics. And it's interesting... No, sorry, I found a video of McNamara from 83. So anyway, the discussion with McNamara is saying that we've gone out to Wickhow. He's met Frankle, and it was a fascinating discussion because he's talking about the fact that it was Tom Graeber had introduced him to the concept of Frankle. So clearly, as we discussed previously with Tom Graeber was very forward-thinking. He was very much interested in function and your thoughts. And as you said, you had a very good relationship with him. Did you have a good relationship with McNamara?
Initially, yes.
Yeah.
We were both the same age, doing the same things.
Yeah, okay, because he then, I think other people tell me, has clearly gone against you and clearly thinks you're too far to one side. But that's interesting because here McNamara is saying that he's using Frankels in probably 75 75% of his class 2 he's using Frankels for. And he waxes lyrical about Frankels, says how wonderful they are. Now, let's wind forward. I don't think Frankel is using, I don't think McNamara is using any Frankels now. I would doubt it.
Oh, I don't think so, no.
I struggle to find anyone in Western Europe that's using Frankels at all.
Probably.
I don't know of anyone in America that's using Frankels.
No.
So, what happened?
Basically, changing posture.
Or function.
Very unpredictable. No. Posture. Frankel used to talk about posture.
Did he? Okay.
Oh, yes.
Yes.
But changing posture is very unpredictable and depends largely on the individual children, and most dentists find it unrewarding.
Yes. So we had an option here.
Yeah.
We had fixed appliances that were going to make the teeth, physically make the teeth straight, and we had the Frankle appliance that was going to treat the causes of the problem.
Yes.
And by treating the causes of the problem at a certain level, we're going to debate that in a second, but it's treating the cause of the problem and making the teeth straight as a byproduct of treating the causes.
Right.
Now, one appliance gets you your outcome. The other appliance is dependent on the children. It's dependent on a lot of motivation from the mother.
Yes.
It's hard work. It's difficult. It's time-consuming.
Yes.
Unpredictable because children aren't going to always wear the appliances. And, well, we can see which one.
Yes.
The system that's not interested in the causes is simply making the teeth straight.
I wouldn't say it wasn't interested.
Okay.
But they had to get the teeth straight.
Yes. So here was... Now, it's... I definitely think the Frankle appliances is an appliance that needs to be revived. Okay?
Well, you know my reservations.
Yeah. Okay. Now, why? What are your reservations?
Well, mainly that it doesn't keep the mouth shut.
Yes. Now, I noticed both in what McNamara was saying in that interview, so that was a written interview in the Journal of Clinical Orthodontics, and that'll be another link below. McNamara's interview it will be. And he talks about the fact that he's training kids to sit with things between their lips. Okay? Now, Frankel famously was using little strips of newspaper. Mm-hmm. And he would get children to put them between their lips to help keep the lips together. Because newspaper is not only incredibly cheap, even in Eastern Europe.
But it tends to stick to the lip. I think he was using plastic mostly.
Okay, was he? Because I remember you talking about the strips of newspaper, because that increases the surface tension.
Yes.
And by increasing the surface tension with the fine fibres of the newspaper between the lips, we have found it very effective.
Yes.
Yeah. In fact, I'm going to try that on Zarina at home. I'm going to give that a go because her lips are apart too much of the time. Now, okay, so carry on with this, the lip closure. Okay, so Frankel and McNamara are both talking about the importance of getting lip closure, but the appliance doesn't do this.
With the individual appliance doesn't, no. But Frankel was copied by a lot of Peter Bimler, another German orthodontist, copied the flanges.
Yeah.
And he put them onto a monoblock, a functional appliance.
So the monoblock had been invented sometime before.
Oh, back in the 20s.
Okay, so monoblock was invented in the 20s. Bimler's taken elements of Frankel and placed them on a monoblock. Yeah. So in some ways, Frankel lives on.
Yes.
Because Bimler appliances are still quite popular.
Yes, I mean, he was a good clinician.
Yeah. And what else do you think they're not doing? So, well, I guess what else? I mean, that's the big problem. People can hang their mouths open, and if they hang their mouths open, then none of these functional appliances are going to work.
No.
And then that's where you came in with the Bioblock orthotropics.
Yes, stage 3 and 4.
Yeah, the stage 3 and 4, because they're giving a feedback if people hang their mouths open.
Yes.
Okay, but they are quite difficult to adjust.
Very.
And they require a motivation to wear.
Yes.
Okay, so just a little bit like you're in the same camp as Frankle here, in the fact that you are promoting appliances that are hard work and they're not getting a direct action. You're treating the causes of the problem, trying to unwind the symptoms, which is the crooked teeth.
Yes.
Okay? Now, in many ways, frankly, we ignore the mouth hanging open, okay? Then Frankel had some really clever ideas with his appliance.
I thought it was very simple, but I agreed with him.
But it was clever.
Yeah.
Yes? And he could gain quite a lot of expansion with these appliances.
Yes. You know that I created what I call the vestibular appliance,
Yes.
which in some ways was the same.
Yeah, that's a fascinating appliance, but the subject of the moment is Frankel's appliances. I want to discuss the expansion he could get with these appliances. Could he get quite a lot of expansion with the appliances?
I don't have remember measuring it, but yes, he told me and I could see that he was getting expansion with the Frankel appliance alone.
Yes, and there was a lot of really interesting investigations. So I think when Melvin Moss was looking at the functional matrix hypothesis, he was really drawing from Frankel and drawing from how the fibers, so these muscles here, the muscles surrounding the face, the fibers of these muscles are going into the bone, and by stimulating, pulling those cheeks outwards, that people was feeling was stimulating the periosteal growth where those fibers join the bone.
Yes, yes.
Yeah.
You know that I don't altogether agree with Moss either.
I totally understand, but I know that Moss was really interested in this.
Yes, no, he was.
And he was really, I know that Frankel stimulated this interest in this specific area. And that, that fascinated me. And of course, one of the really good things about this expansion is, and it's a good skeletal output, because Frankel used to say that he's treating the skeleton, not the teeth.
Right. He told me very directly, he's treating the cause, not the symptoms.
Yes. I remember a note on an article from Frankle that you had, where Frankel had written that in hand across
very
the
much
article.
so.
Yep, so I just remember seeing that, and that really fascinated me. Now, but that brings me on to another interesting point, because if you simply gain expansion by moving the teeth, treating the symptoms here, then you're not going to be moving the bone, our alveolus, and the supporting structures.
That's not always true.
Okay.
I mean, I have expanded people with the stage 1.
Yeah.
And they have then put their tongue on their palate afterwards as a result.
Yes. And so, yes, and so basically you've initiated a change in pattern of behaviour.
In form.
Yes.
Which is allowed to change in function.
Yes.
And posture.
Okay. Now, let's say you were to just expand the dental arches. So a lot of people who follow us on this channel, who are interested in what we're doing, are very pro-expansion.
Yes, chest expansion, some of them.
Now, if you're going to do expansion, that's artificially moving the teeth, and then you hold that expansion without changing this muscle balance, do you risk causing damage?
I wouldn't say it's damage, but I think it's very likely to relapse.
Okay, what if you then put someone in permanent retention and prevent them from relapsing?
Well, that's an interesting question again, because it would depend what posture the patient had, because you would then have fixed appliances fighting against muscle forces, and almost anything can happen then.
Okay, but there is a risk where one of my little concerns here is the fact that we're holding, a lot of people are using permanent retention.
Yes.
And if you're using permanent retention, whether or not the permanent retention is maintaining the alignment of the teeth, whether or not it's maintaining expansion, whether it's not maintaining the lower incisal positions, preventing lower incisors from crowding up, somehow you're interfering with the natural balance of things. And then you risk, you can hold the teeth in this position, but you can't hold the bone and the supporting tissues.
Well, no, you can't.
And so if you have to wear a retainer, because your teeth are risking going backwards, then you're potentially holding your bone and supporting tissues at risk.
At risk, yes. It depends on what posture they adopt.
Yeah, and I do actually think function comes in here a little bit as well when we're talking about simply the alveolar bone. Yeah,
they're related.
They are related, and I think a little bit more. So I think when we're talking about the posture of the mandible, then it's important to talk about the posture. Although again, I think you discount muscle strength in the masticatory muscles more than I do.
I don't treat it because I don't know how. But I think it is important.
Yeah, you can get people to chew on hard gum.
Well, yes, I've tried for 50 years to get the right sort of gum and not been able to.
Well, I know you endlessly wrote to, was it Wrigley's or one of the gum manufacturers?
I've tried all sorts.
And decades you were writing to them saying they need to make harder gum.
And they wanted to make softer gum.
Well, they said that their research all indicated that people wanted softer gum.
Yes.
That's interesting in itself, that piece of research. I have a feeling that they're going to be thinking about harder gum now because harder gum has taken off in a major way around the world. And I'm sure they're going to want a bit of that action. Okay, so is there anything else we've not covered?
That Germany led the world in functional appliances. You really ought to put that at the beginning, but they do.
Yeah. Do you think they still lead the world in functional appliances?
Oh, no, very definitely not.
I think I would appear to be.
After the war, they copied the Americans.
Yes, it does appear to me that there's been this rush to gain aesthetic dental alignment.
Yes.
Treating the symptoms, not the causes, is exactly Frankel says. Right.
Indeed.
Okay, I think that's great. What about, this is a little bit about the end of your trip when you went to see Frankel. Because I remember there were some interesting stories. One evening, you ditched your bodyguards, your spies.
That trick.
Yes, so you what did you do?
Well, they appointed two guides who were actually two spies who were reporting back on everything we did. That was your mother and I. Remember, this was East Germany at the height of the Iron Curtain. Mm. Anyway, so we were followed everywhere we went. So we returned to our hotel, and as we went through the revolving door, we ran as fast as we could to the back door and went out onto the street behind the hotel. And we were able to get away from our two guards. So then on our own, for the first time, we went downtown, and I remember going to a restaurant where people had never ever seen anyone other than East Germans in their whole life. We met an old man who'd been a soldier in the First World War, and all he could remember about England, he was in prison there, was the bloody fog.
And you spoke some English?
Yes, just not much. Bloody fog was about it.
Okay, and then also you had an interesting anecdote on your way home.
Well,
so you're on the train,
yes,
leaving East Germany, going to West Germany.
Yes, and of course when we got to the border, they were very keen on stopping any East Germans escaping to the West. It was a capital offence. If you tried to escape from East Germany to West Germany, they could shoot you.
Yes.
Fairly serious stuff. Anyway, I knew that, so I took my suitcase, wrapped it in my overcoat, and took my ski boots out and hid them all rather badly under the seat in the train, so that someone looking casually might think it was someone trying to get out of Germany. And of course the border guards saw that and pounced on it. And do you know, they were not remotely amused.
Really?
No.
No. You're playing with fire here, Dad, as you have much of your life.
Right, and they
As I
didn't
guess
shoot
I
me
have.
either.
No. I'm glad to hear. Okay, all right. Thank you very much. And a word for our sponsor. We're sponsored by you and the Mewing app. If you want to directly help support our challenge, our mission to gain debate on why teeth are crooked, understand the process to look for prevention and better treatments, then please sponsor me directly. Please donate to our cause. Follow the link for donate underneath. Then subsequently, if you want to help support us, please support our sponsor, which is the Mewing app. The Mewing app supports all that we do. We were talking about posture and function. We were talking about the balance of these soft tissues. Well, if you want to understand that yourself, you can make yourself better, or you can make your child better simply by training these muscles. And that's what the Mewing app is all about. So if you want to gain personal self-improvement, which hopefully would avoid orthodontic treatment, but if you're going to get orthodontic treatment, it's going to minimize the duration, maximize the outcomes, and minimize any relapse afterwards. As we discussed, if you're wearing a retainer at night and you need to wear that retainer at night, why? What are the possible downsides, and why aren't you mewing? Because if you're not mewing, what are you doing? Thank you very much.
May I finally say, this is important just for your health and for your appearance. It makes a big difference.